For me, the choice was, at first I think started out, or at least in my head, just with wanting to lose weight. But along the way, I think the eating disorder became more of a coping mechanism for me in dealing with the stress and pressure I felt.
While many people will follow diet and exercise plans at some point in their lives, most do not develop eating disorders. But unfortunately, that's not the case for some who are genetically vulnerable or at risk for a variety of other reasons. Instead of following cues from the body and mind about hunger and health, rigid rules about food and appearance are created, and the eating disorder takes control.
I would constantly be thinking about how I looked and how others see me and how I couldn't eat in front of other people, and just so many of the rules that came along with the eating disorder.
Eating disorders, often associated with depression and anxiety, develop from a combination of biological, psychological, and sociocultural factors. It doesn't help to tell someone, just eat. These disorders are serious mental illnesses that are so strong, they can override the survival instinct.
On some level, I was aware that it would lead to death. It doesn't seem realistic, almost. Like, you don't really like to think about those things.
Having an eating disorder is very lonely a lot of the times, and just trying to stay afloat, I guess, was really hard. Everyday life was a struggle, and I didn't know if I was ever going to recover.
Because college students are in the typical age range and undergo significant life transitions, they're more at risk to develop eating disorders. Left untreated, eating disorders can interfere with the body's systems and become chronic and even lead to death. Early identification and treatment is crucial and leads to better outcomes. Eating disorders are not phases. They have the highest mortality rate of any psychiatric condition.
The hope and courage came from that, thinking that there had to be something more, I think. That I think there were many times where I didn't necessarily not want to be here, but I just didn't want to be in the eating disorder. So it's just like imagining that there had to be something else.
Here's the good news. With treatment, complete recovery is possible. The healthy, spirited self is not gone. It's eclipsed by the power of the eating disorder. With help, you can restore to a healthy weight, be grateful for your body, feel feelings, think more realistically, connect with people who matter, and live a life of meaning.
I am just coming to terms with myself, just accepting myself and gaining more self-confidence, I think. I just want to sort of release those worries that I have about, or all those doubts, and just be happy with who I am.
Right now, in probably the best place that I ever remember being in life. I just got so much of my life back.
For more information, or if you would like to speak with someone about yourself, a friend, or loved one, call social services at 510-642-6074. For medical care, call the UHS clinic at 510-643-7110. Dietitian appointments can be made at 510-642-2000. More information on eating disorder concerns can be found at the Tang Center or by visiting our website.